Hi, I'm Trista Zinn. I'd like to share with you my personal story of the discovery, treatment, and recovery of my stage 2 cystocele, which is pelvic organ prolapse of the bladder. A bit of background about myself is I have been in the fitness industry for over 20 years, and I do have 2 kids. I've got a 13-year-old daughter and an 8-year-old son. Anyway, it was at a pelvic floor physio assessment a couple of years ago where I found out that I had this stage 2 cystocele. And I had gone to the pelvic floor physio originally because I had taken a pelvic floor health certification course and found out how common incontinence was, although I don't have incontinence or didn't have incontinence. I also didn't have signs of prolapse, but I'd found out that we need to get our pelvic floors assessed, their health, and see if we were predisposed to prolapse, or maybe had the onset of the early stages of prolapse. So at this appointment where I found out that I had the prolapse, I left really devastated and really fragile and broken feeling, actually. I'd also found out that a lot of the exercises that I was doing and the running I had to stop because it could increase the chances of it progressing to a stage 3 or stage 4 where surgery might be the only option. So after a lot of crying and trying to sort of figure things out, I decided I needed to kind of address this like an injury, and if my pelvic floor wasn't functioning as it should, I needed to rehab it in order to start hopefully reintroducing the exercises I was doing. And it was at this time a friend of mine had asked me if I'd seen this HYPOPRESSIVE method, which was is a breathing method that involves certain postures and poses, and was successfully being used in Europe for close to 30 years. So I looked into it, and the majority of it was in Spanish, and I Googled and tried to see what they were doing, and somehow I connected with the breath. I don't advise necessarily self-training yourself by YouTube, but that was what I did. And I happened to train myself enough and try and mimic the poses that after 2 weeks of practice, I went back to the pelvic floor physio, and my stage 2 had gone to a stage 1. And we were both shocked and really pleasantly surprised. And I then decided, you know what, I had to find out how I can learn this method and get certified so I can introduce it to Canada and help other women recover and prevent prolapse and incontinence and educate them more about pelvic floor health. So Kaisa Tomain, who was the only English certifier at the time, was in Banyoles, Spain. So I flew to her, and she certified me in level 1, where I learned how to properly do the poses and the importance of the proper postures and poses, along with this breathing technique, but also found out too that a lot of the traditional exercises that we're teaching over here in Canada were and are causing detrimental pressure to the pelvic floor and are increasing our chances of developing prolapse and incontinence. So the course was a bit of a slap in the face as far as that goes. But I came back to Canada, and I followed through with the intensive phase of the HYPOPRESSIVE program, and was really actually falling in love with this new way of training and correctly working my core that involved the pelvic floor and my diaphragm. And after doing the intensive phase for 4 weeks, I went back to the physio, and we were blown away. My pelvic floor tone had normalized. My prolapse was completely gone. And I was told I could slowly start to introduce my exercise again, and I slowly started to introduce my running again. And I have to tell you, there's a wide variety of exercises out there that I will no longer do because of what I've learned. And because of my love and passion for the HYPOPRESSIVE method, I've gone back and forth to Spain 4 times now since then, and become a qualified master level trainer and instructor for Canada, because I really want to spread the word and help certify other instructors. I had Kaisa come over in 2012 and 2013 to certify instructors and physios, so bit by bit we'll get some physiotherapists and trainers across Canada who know how to correctly train your core and help prevent prolapse, incontinence, and pelvic floor dysfunction. So stay tuned for some of my other YouTube videos.